Okay, so this is the last lecture on schizophrenia spectrum and other psychotic disorders, and what we're going to focus on is treatment. Now, similar to what is known about the causes of psychotic and related disorders, we don't exactly know how to treat it, but we have eliminated some possibilities. So we know that psychotic disorders are not best treated by exorcisms. That's something we know. We also know that despite how these disorders have been historically treated, they are not best treated by any combination of bloodletting, spinning, shaking, sensory deprivation, lobotomies, ECT, opium, or chaining people up and depriving them of their humanity. Which has led us to the current practices, which suggest that these disorders are best treated with a combination of psychotropic medication and psychotherapy. So let's start with psychotropic medications. Overall, there are two types of antipsychotic medications that are typically used to treat psychotic symptoms, and they're called typical antipsychotics and atypical antipsychotics. So typical antipsychotics are also known as first-generation antipsychotics or conventional antipsychotics, and as these names suggest, these were the first types of antipsychotics that were developed. So medications like chlorpromazine, which is known as Thorazine, flufenazine, which is called Prolixin, and haloperidol or Haldol fall into this category. And all typical antipsychotics work by blocking receptors in the brain's dopamine pathways, or at least that's what we think. And research has shown that these medications are highly effective for a lot of people, particularly in reducing anxiety, agitation, as well as delusions, hallucinations, and disturbances of speech, so especially good in treating positive symptoms. However, they also have some really serious side effects, so things like drowsiness, constipation, fine motion tremors, nausea, dizziness, weight gain, sexual dysfunction, and something called tardive dyskinesia, which is an irreversible side effect of typical antipsychotics, as well as certain other substances, that involves involuntary movements of the tongue, lips, face, trunk or torso, and extremities. And these symptoms are extremely problematic. First, because they're extremely disruptive, which you'll be able to see in the video that I post online. And because, as I said, they're at this point irreversible. Because all of these side effects can be quite debilitating, medication compliance is sometimes really difficult when treating psychotic disorders. In an attempt to try and lessen these side effects, atypical antipsychotics, which are often called next-generation or second-generation antipsychotics, were introduced. And the medications that fall into this category are medications like in an attempt to try and lessen these side effects, atypical antipsychotics, which are often called next-generation or second-generation antipsychotics, were introduced. And the medications that fall into this category are things like clozapine, risperidone, and olanzapine, which is known as Zyprexa. As far as we understand, these medications work by blocking a broader range of receptors than typical antipsychotics, which might explain why the side effects are somewhat less, including a much smaller chance of developing tardive dyskinesia. And so, as I mentioned before, in part because of side effects, medication compliant rates are typically pretty inconsistent, meaning that people go on and off of their medication. And for certain types of medication, cycling on and off is particularly problematic because tolerance can develop, and as a result of that, when people cycle back onto their medication, they need a higher dose. And part of the reason why this is so problematic is that at higher doses, side effects also increase, including the risk for tardive dyskinesia. Because of this, psychotherapy is often used to increase medication compliance and also do a host of other things. So, for example, individual therapy is often used for stress management and relapse prevention by teaching alternative coping skills. Rehabilitation therapy is used to target life and work-related skills, which is especially important because people are often forced to change careers as a result of their symptoms. Family therapy is often used to reduce expressed emotion, which, as you remember, is a risk factor for psychotic disorders, and to increase support and understanding. Cognitive behavioral therapy has been used to help clients learn reality testing, social skills, and self-care. And group therapy is becoming more common to provide clients with support. So that's the end of your lectures on schizophrenia spectrum and psychotic disorders. If you have any questions, make sure that you're adding them to the discussion page.